died in an outbreak of the new coronavirus, which has now reached the United States.
We don't know if it's controllable yet.
The risk to the American people remains very low.
Other people may be left without necessities
I'm so
like
nervous.
food, medicine,
I don't
and
know what to
toilet
say. I'm not
paper,
prepared.
which has been flying off the shelves.
My name is Alex Roxas.
I'm Joe Castellanos.
My name is Hannah Verbeek.
My name is Bud Baker.
My name is Brandon Leventhal.
My name is Brooke Chira, and I work part-time as a crossing guard and part-time as an ice cream scoop.
I am a physician. I'm training to be a pediatric doctor.
I'm a janitorial sales account manager.
And I'm a student here at Montclair State University.
I am a student who is Montclair State University. I'm a junior.
I worked at a sushi restaurant as a delivery driver and a host.
Fear started raising for me whenever I started hearing about cases in Chicago, California, and they started really getting bad whenever cases hit New York.
I saw a lot of similarities to SARS, which is another coronavirus, so I figured, they'll take care of it. It's bad, but it won't be terrible. They probably get it under control.
I don't think I thought it was going to be as bad in New Jersey as it was. I had a feeling it was going to be bad throughout the entire country, but I didn't know it was going to be as bad as it is in New Jersey now.
We had a lot of warning from other countries and stuff like that, and I thought we would learn from them and be like, all right, we know how to do this, but we don't.
I'm concerned. I'm worried about it. I've known people who have had relatives pass, and my heart goes out to them.
This whole thing really hit me whenever my uncle got infected. Well, it was a mix of that and just hearing about cases popping up in Montclair and then cases popping up in West Orange. Everything just led to another, and it started this whole snowball effect into reality setting in.
5 weeks ago, that's when we started implementing masks at all times. Every day I came in, I had to alcohol everything. So my seat, my workstation, my computer, they made us sit. Typically in the NICU we have 3 computers where the residents sit in a row. They weren't allowing that anymore, so I had to go out of the room to chart at my own private computer, which was annoying.
I haven't been paid in over a month, and that's really scary. Originally, I was working as a crossing guard at Montclair State, and I lost my job because they obviously had to lay us all off because no one is on campus to work. I was supposed to start working my summer job on April 26th, and at this point, I don't know if or when we're opening.
I got a call from someone who worked there, and it's like, hey, just so you know, we're closing for a little while, so I know you were planning on coming in this weekend to start, but we can't do anything about it. And I'm like, that's okay, that's not your fault. And then literally a day later, my other boss from the sushi delivery or the sushi place was like, we have to close too. And I'm like, guess I'm out of 2 jobs now. I'm at least thankful that I'm not in a position where it's a problem. I live with my parents, so I'm not paying rent, and it's not an issue, it's just kind of an inconvenience.
I started doing DoorDash again because they've been giving a lot of bonuses, so you're making more money per delivery. And is it dangerous? It's probably pretty dangerous, more so obviously than staying indoors, but I just feel like as long as you wear a mask and you wash your hands and be extra careful, your likelihood of getting it goes down. I'd rather not have to be doing it, of course, but it's just the way it is.
Yeah, as I mentioned, I work for a company that sells janitorial supplies, and part of the janitorial supplies that are involved in that part of the market is disinfectants, wipes, all kinds of preventive measures, PPE. So I've been keeping somewhat busy with the few customers that are still open. So it's keeping me going, at least on that sense. But business is way down, not just for me, but my entire company is suffering right now.
My dad got furloughed from his job. We've been trying to make sure that he gets his benefits every week, but it's such a process. He has gotten a little bit, but it's not nearly as much as was promised or was estimated. And my sister, She's a teacher, a high school teacher, and she's made the transition to online teaching, so thankfully she still has her job. My mom as well, she works in a hospital. Hectic every day. Some messed up stuff has happened there, just in the form of, like, they've been opening up floors of the hospital to COVID patients, and there was a possibility that she would be added to one of those floors, but, like, she herself is immune deficient. She has a doctor's note, and she has someone at home, me, who is immune deficient. For them to even consider putting her on that floor is messed up.
The world now has more than 1 million confirmed cases of COVID-19.
Like, things just feel...
Country with the most cases
Oh, did my camera turn off? Oh,
continues
shit.
to be the US, with more than
Alright, gotta work
200,000.
around that. Syncing on 3. 1, 2, 3.
My camera cut me off, and I'm very upset because I didn't think it would do that.
Any other comments before we start filming?
Why? I thought you said this is what it's going to be about. What is the subject going to be?
That's a lot of questions.
I think it's about the same amount as last time we went through.
I know I shouldn't be touching my face right now. My hands are washed, so.
So, what have you been doing to pass the time during quarantine?
I've been doing everything and nothing.
Pretty much staying home.
Playing a lot of video games.
Left 4 Dead.
Legend of Zelda,
Call of Duty.
a lot of Animal Crossing New Horizons on the Switch.
Puzzles, we play board games.
Playing with friends, actually.
I go out and exercise by myself.
A lot of movies and TV shows.
Binging a lot of stuff on Netflix.
I've been baking a little bit here and there.
And I've also been doing DoorDash to make some money.
And I come here, I go to sleep, hang out here on my off days, and then I go back to work. It's good.
We gotta do what we gotta do, you know?
Mm-hmm. What's the overall atmosphere around you? How do things feel?
I'm definitely stressed.
I don't feel stressed. I don't let it affect me at home. When I'm home, I'm home.
Bored.
You know, I just get filled with dread.
Mentally, my mental health has gone down the toilet, and that's, I think everyone's has.
It doesn't affect me mentally at home.
I can't see my family as much as I like to also. That's the toughest part of the whole deal.
I've actually left the house more than I should.
3 or 4 times since it all started.
I'd say like 5 times.
Probably around 7.
Almost every day. Again, I exercise like 5 or 6 days a week. I go out for a jog. And I go see my kids a couple times a week. That's about all I do.
The last time I was out, I ran into my aunt who lives in town. And we just saw each other and I was like, hey, I haven't seen you in person in over a month. That's weird.
It feels like I'm doing something wrong, you know, to go anywhere, to do anything. My brother and I both went into Wawa together and people looked at us like, why are you out? You damn kids, like, what are you doing? I think that had a lot of stigma because that was around the time that there were a lot of spring breakers in Florida talking about how they didn't care. We are around that age, so obviously it would look like we're going out, we're, you know, congregating, we don't care because, you know, we're 2 teenagers buying soda and chips.
One of the first times I left the house after all this started was to bring supplies to my uncle. He got infected. The second time we left the house was for the same reason, but it was also because, you know, his family was in quarantine with him, and they ended up getting it as well.
My grandmother, she got it, and unfortunately she passed away. She couldn't die with us by her side, and we couldn't have a funeral or sit Shiva. They just took her and buried her, and that was that. For her to die like that, alone, without us there, from a stupid virus, it's criminal. You see on TV, you know, 800 people dying in New York a day. That's 800 families a day going through the same exact thing that me and my family are going through. And it's just so messed up, and nobody should have to go through this. It's unfortunately a huge tragedy at all levels.
My mom's cousin, he works as a prison guard. Him and his partner both lost senses. He lost his sense of smell and his partner lost his sense of taste. They both got tested, and I know that my mom's cousin tested positively, and we found that out yesterday. I'm pretty sure he's gonna be okay, but it's still scary, you know, not knowing and all of that.
My dad works as a postman for USPS. I've seen a lot of stuff about the United States Postal Service and how they're just a problem. Not necessarily like in terms of how they're treating their employees, but just that they're not taking a lot of precautions that they should have. And my mom is a nurse at St. Barnabas Hospital, which is concerning. She works in the neonatal intensive care unit. It's the ICU, but for premature babies. So she's not in the thick of it, thankfully, but she's still going every couple of days to a hospital where it is very real.
Well, we've seen a spike in, obviously, COVID-related stuff. Mm-hmm. It doesn't affect pediatrics as much as it does adults. Mm-hmm. But they have started, we have a few of our internal medicine residents that are out because they're either sick with it or they were in contact with it and had to be quarantined. So we're actually having to pick up a few ICU shifts. So we're treating adults now. I didn't think I'd ever get to that. I got into pediatrics to treat kids, not to treat adults.
I have not been a victim of xenophobia personally, but I have seen xenophobia towards Asian people, unfortunately. At the supermarket, I saw a whole bunch of families go out of their way to move away from Asian families, and I just thought that's so uncalled for and so horribly racist.
I know you said you worked at a sushi restaurant. Have you experienced any xenophobia there?
I remember this couple came in once, and they were an older couple, and they came with like a big thing of Lysol wipes, and they came in, and I showed them their table, and they took everything off, and they wiped it down themselves, and then wiped down the chairs, and they wiped down their utensils and everything, and I was like, but I was so afraid that they were going to come to me and say like, can you be the one that gives us our food? I was very scared of what could have happened, and thankfully nothing did.
I didn't even catch this as it was happening, but I was at a coffee place with my sister. She told me, like, as we were leaving, that, like, there are these two girls behind us just talking to themselves, just going, like, how do they know they're not sick? Another highlight was, we need to find out a way to keep them in one area. To keep them away from us. Hello? Yeah, let's bring back internment camps, because those worked out so well.
Do I think that the online transition will negatively affect my education? Yes, and it has.
Overall, it's definitely negatively impacted my education. I'm a film student, and so film is obviously a very physical thing. Any internships I could have tried to get over the summer are pretty much canceled. So I can't even do anything until the spring when I don't have a lot of classes to take. And I just don't feel like I'm learning as much over the computer.
Personally, I don't do well in online classes, so having to transition my entire spring semester into online classes was not easy or fun.
Before we transitioned to online, like, I was really worried that, like, I would start falling behind on assignments or just, like, not having the motivation to do the assignments, but I've been getting stuff done.
When I don't have to go to a class, I feel like it's optional. And I saw that on Twitter somewhere, this semester feels really optional. And I can't help but agree. I'm trying so hard to, you know, do all my work and stay on top of everything. I had one of my professors say, this is do at your own pace. And I haven't touched much of the work since.
I personally prefer doing an in-person class just because it's more motivating, I can see more people, and, you know, there's more pressure to do the work and to pay attention and to participate and stuff like that versus when you're at home and you're in the middle of a pandemic and just every single thing is distracting you. Like, oh, I gotta clean my room today. Oh, I should really go do laundry. Or, you know, you're much more susceptible to doing other things than your schoolwork. So that's made the semester just all the more difficult. So, yeah.
The race to reopen the ailing economy is picking up speed, even as the coronavirus outbreak is, according to health experts, far from over.
Just yesterday, the president announced he was winding down the coronavirus task force, even though the pandemic is just now ramping up in some places, with the largest spike in new cases now in Nebraska and Minnesota.
In San Diego, demonstrators showed up waving flags, holding signs, voicing the same demands.
It's not fair to the rest of us that don't have COVID-19. We all need to get back to work.
And yesterday, hundreds of people, as Joe said, protested outside the state capitol building in Lansing, calling for an end to the state's extended stay-at-home order.
Well, as Governor Murphy is treading lightly on his roadmap to recovery, protesters in Trenton want him to pick up the pace and open the state right now.
I mean, the way things look right now, the country is opening up in a couple of days. And I do not agree with that.
I think that they're trying to, Congress and the Senate in its administration is trying to push us back too fast. I think we need to take a little bit longer. I know that's very difficult to do, including for myself. But we have to get this right because you're starting to see protests all over the place. Now people want to get back to work in certain areas of the country. I understand it. I respect it. But we're not there yet. And that's the danger, that we go back into this too fast and then people start getting sick again.
You know, and I just want people to stay home, and I want them to... I want people to stay home, and I want them to stop protesting, and I want them to just chill out.
The numbers keep adding up, day by day. And opening up the country again, those numbers will skyrocket.
We in New Jersey have been in quarantine for significantly longer than other states. We're freaking out and rioting, and you know, our numbers are worse. And I think that that's something to take into consideration. I think this is going to get a lot worse before it gets any better.
My outlook on the future right now, I mean, like I said, I'm fearful of the future, but I'm also hopeful in a way.
I don't know what'll stay the same. I think people want to get back to work. I think people will conduct themselves, hopefully, in a manner that they don't get aggravated real quick with things if they don't go their way. There's a lot of people struggling out there now. There's going to be some bitter resentment when things come back to play. I think a lot of things are going to change. I don't think there'll be too much that will be the same, except maybe going to work, being able to go to the park, go to the beach, go to a ball game, but all those things are going to have something different than they have now.
I think obviously, I don't think places will be at full capacity at all. You know, we'll all have to wear a mask and we'll have to be socially distanced still, but they'll probably open up more places. Like maybe they'll open parks, but I don't think we'll get back truly to normal until a vaccine's created. Because that way we can ensure everyone's immune to it. But until then, like, you can take steps to normality, but it won't be truly what it was until we have a vaccine.
I don't know what's going to change. I don't know if anything's going to change. I want things to change. I want there to be a better... I want WHO to get funding. I want our pandemic response teams reformed. I want people to learn from this. I want universities to learn from this. I want the whole country to learn from this. I want them to learn how to better equip themselves for this kind of situation.
I don't know what normal will be. I think we're going to have a difference in a lot of ways we go around doing business. People may not shake hands anymore. People may have to be more cautious of things out there. I think the general public is going to be very, very, very acute in wanting to know, are areas disinfected, is this clean, you know, more than ever before.
I don't think there's any specific definition for back to normal. I think everyone kind of has their own variation of it. And when I think back to normal probably for me is just being able to hang out with my friends again. That's the one thing I miss more than anything. Being able to see people aside from my family.
I'm hopeful that as a world we can learn from this. Chances of that in my eyes are slim, but I'm still hopeful for it.
I want the landlords to stop charging rent during all of this. I want better healthcare. I want a lot of things, but I hope for a lot of things, but I don't think we're gonna get any of it. If I'm being honest, I think that we live in a really greedy society and a really selfish society, and I think that shows a lot from the people who are protesting the stay-at-home order. I want people to learn to love one another and not themselves. I want people to think about other people, but I don't think that that's going to happen.
I think the outlook on the future is one of which we have to be cautious. I think we have to be smart. I think we need to listen to the people who are telling us what to do and how to do it. The natural tendency is to get back to normal, but the normal is going to be different. The normal is not going to be what we've been accustomed to for a long time, and we're going to have to look at that way.
And I just hope that we can all look back at this period in our lives and just have it be that, the period. A story.
I hope everybody stays safe. Make sure you let your loved ones know you love them, especially if they're at risk, because you never know if it'll be the last time you ever talk to them. I love you, Grandma. Always.
The coronavirus has already changed so many aspects of our everyday lives. So what does the future look like? KCTV5's Joe Chiodo investigates this good question.
This week, we've given you a look at proposed changes for flights. Notice the dividers between each seat. We've also showed you what the future of restaurants will be like, servers wearing masks. But now we